Hey, physical therapy friends, it's Dr. David here with your first ever Research Review Mondays. I'm going to go over real quick here the kind of my 2 cents. I'm not going to go into the article. You can do that on your own time. I'm not going to go through every section. That's not what the intent is here. You do that on your own. But I'll post the link for the article in the comments, so watch out for that. The article is titled A Risk-Benefit Assessment Strategy to Exclude Cervical Artery Dissection in Spinal Manual Therapy, a comprehensive review. So what I got from this article is that there still is no clear tests to find out which of your patients are at risk for cervical artery dissection. And if you're thinking, I need to go look that up. What is that? That means, in other words, when you do some sort of neck technique, whether it's just a basic mobilization or some sort of manipulation, how do you know if this person's at risk for you to injure their vertebral artery or their internal carotid artery and possibly kill them? You got to be careful with that because you want to make sure that everybody's safe. So there's no tests that really clear this up for anybody. I'll tell you what I do personally is I take a really thorough assessment, subjective history whenever I'm talking to them. I look to see if they have any comorbidities that would be, circulatory in nature or cardiovascular, of course. These people typically have neck pain, and that's what they're coming to you for. They may also have headaches as well, and that's the signs of a vertebral artery problem or an internal carotid problem. So you have to be very careful. I'll start doing a manual therapy technique on them if they clear the subjective part, and then I won't do a manipulation right away. Almost always, it's quite rare. It's probably once a year that I'll go straight into manipulation with somebody the first visit. My test, in addition to the subjective history, is doing a little bit of easy manual therapy on their neck, see how they tolerate it, see if they're getting better, if they're improving, and if I'm not getting the improvement that I'm looking for, that I'm expecting, with just the lighter, less risky manual therapy techniques, and I see that there's a chance that they're going to improve with a manipulation of some sort, then we'll have a discussion with the patient about it real quick, just get permission and let them know what's going to happen, and then go for the technique. And it's always super relieving when it's like, pop, 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 everything loosens up and they're like, whoa, that was so stuck, I can move now. So that's how I go about it. Anyways, if you have any questions about this article, if you want to discuss it, start leaving comments down there. I love to see you in video like this. So if you can, pull up your phone and just ask your question live on video. I love that. That'd be really cool. I think for everybody else to get involved as well. And that way we can start a discussion about it. And if you have any questions that you don't want to share with the whole group for some reason because it's kind of personal somehow, we get that sometimes, you can direct message me too. Anyways, I hope you have the best Monday. Bye-bye.